Greetings. This is Justin Allen with the Elite Nurse Practitioner. Welcome to the Elite Nurse Practitioner Show, podcast dedicated to nurse practitioner entrepreneurism and achieving financial freedom, where I talk directly with nurse practitioners who need help. Listen up, our market is saturated. Jobs can be scarce. We are underpaid. We are undervalued. We are taken advantage of by the sharks within the healthcare system, and frankly, screw that. Sick of it, and it's time for a change. And listen, I'm here to help make that happen. We are powerful. We can forge a path where we are in control of our career and ultimately our financial and personal well-being. You do not need to submit to healthcare administrators and your doctor overlords. You do not have to take the measly salary. You do not have to work 50 to 60 hours a week. There is a different way, and I'm here to show you that path. This podcast is raw and unfiltered. I have not talked to the nurse practitioners in this podcast prior to the call outside of an email exchange to schedule the episode. What you're about to listen to is a consultation session between a nurse practitioner and myself. It is real, it is unscripted, it is unplanned, and I have no idea what we're going to talk about. Anything and everything can happen during our conversation. The nurse practitioners in these episodes are struggling with an issue in their professional or financial life, and they have reached out to me for help. My goal is to help the nurse practitioner with actionable advice that will enhance and improve their professional, business, and financial life. My other goal is to hopefully help my nurse practitioner sisters and brothers build a more productive, powerful, and free life. So I hope the content and information within these podcast episodes does just that. All right, onto the episode. Hello, everyone. Today we'll be talking to Kimberly, who is an adult and women's health nurse practitioner. Currently, she's working full-time within the VA hospital system. She is currently in the process of starting a primary care practice, but is wanting to begin with telemedicine to keep costs down as her business grows. She's needing a direction on the best path to take for optimal success. Hey, Kimberly, how are you?
Hey, I'm doing great. Thank you so much for this time.
Yeah, absolutely. So tell us about yourself. How long you've been a nurse practitioner for, and what you've been doing. I guess you're working at the VA system.
Yes, I am a nurse practitioner. I've been doing this for about 12 years now. This is my second career. Prior to that, I was a dental hygienist for 20 years. I am also a Navy veteran, single mom of 2 kids, and I am trying to establish an income that's going to last after I retire. So that's where I am at this point.
Gotcha. Okay. So how long have you been working at the VA for?
I have been here 10 years.
10 years. Okay. So are you wanting to stay there to get like the federal pension and benefits and stuff after the 20 years or whatever it is? Like what's your
Correct.
goal? Yeah.
So I'm going to get that. And while I'm working, I'm doing my practice. So it's going to start slow. And then since I don't have much time left, I have like 10 years left, and then I'll get my pension. But I want to be making an additional income and have that already established. So when I come out of here, I'm good to go.
Sure, that makes sense. So how's the pension set up there? Just for some background for people listening. I know after 20 years, what is it? You get like 60%, 70%? Like how does that work?
Right. So you're going to lose a lot of your income, and they tax you so much on your, we have what's called a, good Lord, TSP program. And then you have your IRA if you have that established. So it's not really like the old pension system has changed. So you really have to budget and prepare for that because you're going to lose a lot of your income.
Right. So what percentage of your income is the pension?
I want to say 64% is what you'll have to work with after they take everything out in tax.
Yeah. Okay. I think you're right. Because I have a friend who works at the VA, and he's going for 25 years or something. It's like 80% or something like that.
Mm-hmm.
So after taxes and everything's said and done, you get 60, basically about 60% of your current income. So that'd be like what, $60,000-$70,000 a year?
You right at 90. So that
right.
Yeah, you'll be right at 90.
Okay. So you'll make $90,000 a year for basically the rest of your life.
Yeah. Not bad, but still.
Well, still, right. Okay. So, but the point I'm trying to make here is that for $90,000 a year passive income, that's pretty much guaranteed. You would have to have, most investments in fairly low risk investments like
Mhm.
bonds or whatever. Let's say you just get an average of 4 to 5% return. For you to make $90,000 a year, you would have to have about between 2 and $2.3 million invested in an asset that produces 4%.
Oh my goodness.
Correct. That's what I'm trying to get the point here is like within 10 years, you will have something that's worth approximately $2 to $2.3 million. Okay. So that's significant, right?
Mhm.
Yeah.
Right.
Yeah. So yeah, I'd say do 10 more years so you could be, you get $90,000 a year for the rest of your life, basically, right?
Yeah.
Yeah,
Mhm.
that's a no-brainer. So in the meantime, you want to start a business though, so you can turn that $90,000 a year into maybe like 200, right?
Correct, because I have children that'll be in college. I still have to pay that, other expenses, still have student loans. So even though it seems like 90, you don't really see that.
Correct. How old are you?
I am 49.
49. Okay. So
Mhm.
you'll be able to be done hopefully before 60, right?
Yes.
Yeah. Okay. So you're wanting to start a practice. So you kind of in the startup phase. So kind of tell me where you're at and what you've been doing there.
I actually established my LLC in 2019, and I didn't do anything with my business. But I last year I got on Tabra, so I have that established for billing, and I also developed my website. Still haven't done anything with it. I didn't know which direction to go in with the telemedicine. I was trying to get a practice, brick and mortar. That fell through. So then I started working on my credit, but in the process, still wanted to already have the foundation. So now I'm in the process of closing on a location, and I have all this money coming out, but nothing coming in. So that's the major issue that I'm having right now.
Gotcha. Okay. So what kind of services are you wanting to provide at this practice?
So I went through the telemedicine um, class, and I saw where I was making an error of I didn't have a niche. I just said primary care, but that is so wide. And then I don't know what was going on with Medicare and Medicaid because the area that I'm going to service is low income. So I'm going to have to do insurance. But there was something going on with getting credentialed with my business NPI. I don't know what was happening, if there was an issue with the VA system. So I still need clarification on that. In the meantime, I was going to do the women's health for STD testing and do refills. So that seemed like something that was more feasible.
Okay. Um, well, like refills and stuff like that, I don't want you to really focus too much on that.
Okay.
Yeah, you want this to be cash based?
I really do, but I just don't know how to do the marketing to get the clientele that's needed.
Cash based primary care, just very general services. It's difficult to make that something that's profitable. Okay.
Okay.
So if you want to do more basic, general medicine kind of services like primary care and prescription refills, et cetera, you're probably gonna need to accept insurance. Do you want to accept insurance?
I
I
really
mean,
don't. It's a pain, and you know what?
yeah. So you're pretty much like you're really wanting to like stay away from it.
I do.
Yeah. Okay.
And the only thing I was just playing it safe because I didn't have a building where I could actually see people. But now that looks like it's a possibility that I'm getting there. So I want to make sure I'm going down the right lane because I have everything established,
Right.
but it's just it hasn't been marketed appropriately.
Right. Right. So you have like the basic structure of the business set up. It's just basically just getting it going at this
Yes.
point.
Yes.
Right. Opening the
Mhm.
door.
Yeah.
Um. So in your area, what's the market like? Is it really saturated with healthcare services?
Yes. And this is a military town. Um, so we have the VA, we have Centera, we have um, Riverside, all these different big company hospitals that are eating up the little smaller hospitals, and it's difficult. So if it's primary care is not it, I need to figure out what other things can I do? What am I good at? How do I market that and make a profit from it?
Right. I mean, primary care is profitable. You just have to accept insurance for it to be really profitable. I mean, you can do like the direct primary care route. You can do that.
Okay.
I mean, we've had NPs on this show who've done direct primary care and they do well. So it's possible. Okay. It's just going to be a little bit slower and you just need to be a little bit more patient with it. And you need to ensure that there's a market for it. If you're in more of like a, military blue collar kind of town and people, have a lot of insurance and they want to use their insurance and that kind of a thing, or if it's very middle class, it can be difficult for a DPC to really take off.
Okay.
But it's still possible. I mean, do you have any idea what the population of your city is or just the county?
So this area, I'd say we have about for the area I'm gonna be in. It'll be about 100,000
Okay.
people in that area. And low income, I said the income is right at maybe 60 to 40 to 60,000.
Okay. So if your area, I mean, it sounds like it's more of like a medium-sized kind of town.
Mm-hmm.
Yeah. So 100,000 people, cash-based primary care. I think it's going to be kind of difficult.
Okay.
Yeah. I don't think there's enough people to really get something like that going. I mean, if you were doing DPC in a town of, 500,000 or even 1 million people, there should be enough people to, to have enough
Okay.
clientele to have a pretty profitable practice. The thing is, though, if you're charging $100 a month for direct primary care or $75 a month or whatever, I mean, every 100 patients is going to be $7,500 to $10,000.
Okay.
So I don't know. I think you're gonna have to just really think about it to determine if it's going to be worthwhile or not.
Okay.
So location. You said you had a location that would be good for a practice.
Yes.
Yeah. Okay. Good roadside frontage.
Yes.
Yeah. Okay. Is there a sign
And
opportunity?
yep.
Yeah.
Yep.
Okay.
Sign. Mm-hmm.
Okay. Okay. So if you want to stay with cash, and let's just say primary care is out, then what are you wanting to do?
I really want to do STD services. I know that sounds really weird, but we have a high population of transmission there. So I really want to do testing, education. Um, I thought about hormone replacement, but again, I don't think that population has the income for that. Um, Weight
Now,
loss is just saturated with that.
oh, is there? Yeah, a lot of weight loss
Yeah.
clinics. Yeah.
Yeah.
Yeah. Okay. STD. Again, no one's going to pay cash for that. Okay. They're just not. I don't know of anyone who has a cash-based STD clinic that has done well. Everyone I know started when it closed it down.
Oh, no.
Yeah, you can go to the health department and get that for free. You know what I mean? Like, why would someone pay you?
So let me ask you this: since I also have a license in Tennessee, how can I build up this telemedicine? And I know Tennessee, especially Nashville, is where I'm from. I could do really well with telemedicine. What would be your advice with that?
Well, you need a supervisor first, so you're going to have to pay that.
Okay.
Tennessee's one of the most restricted states in the country.
Okay.
Okay. So you need to have a collaborator. You need to pay that collaborator. You would need to do all that first and foremost. Okay.
Okay.
Tennessee is also a very saturated state
Gotcha.
for everything you could think of. Like there are a lot of nurse practitioners in Tennessee. Okay. I practiced in Tennessee for a while. I got the hell out of there. It's that bad. I mean, there's a nurse practitioner school in like every county in that state. Yeah. Like it is saturated. I love that state. I love it, but it sucks to work in. So I'm not trying to be a Debbie Downer here. I'm just giving you the facts.
No, I appreciate it. And I just needed that extra kit to get going because I'll have my certification in mental health in December. So then I can really I will flourish because
Oh
we
yeah.
have so many things. Um,
So
so
you're gonna have an adult certification, women's certification, and a psych certification.
yeah, and then I'm done. Okay.
Yeah, yeah, I hope so. Okay,
I'm done.
listen. Psych, okay.
Mhm.
Starting a psych practice is probably one of the easiest practices to start.
Okay.
Overhead is extremely low because you do not need a bunch of supplies, right?
Hmm.
You need a couple chairs and a desk. You know what I
Yes.
mean? You don't need much. A vital signs machine, like that's it. You don't really need a whole lot else. It's a very simple practice. It can be started in a one room office. You know what I mean?
Hmm.
So it's very cheap to start and it is very in demand. Okay. No matter where you go, psych is generally needed. Okay. There are very few places where psych is saturated. There are places where it's saturated, but very few compared to like primary care, family, weight loss, etc. Okay. So but you're probably going to need to take insurance. But if you take insurance, open up a small psych practice, you can make a lot of money.
Okay.
Okay. Like I know some psych NPs that kill it.
Okay.
Okay.
And
Like,
that's what I'm looking forward to. I just need a little money to keep going until I get there in December.
yeah. Yeah. So, yeah, I mean, yeah, there's so many opportunities here. I would say that if you could start local, telemedicine's great. It works good, but you have to spend some money marketing it.
Okay.
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 It can be really hard to get the traction that you need for it to really take off. Okay. And you need to have some money to market that thing. So I want you to just kind of keep that in mind that I feel like that the biggest bang for your buck and the lowest barrier to entry here would be probably start something local. And geez, if you could start a psych practice, you would probably do really well. And if it was a combination psych and primary care, you'd kill it.
That's the goal. That is exactly what I plan on doing.
Yeah, you would kill it. Like you would do very well. All right.
Yep.
So, I mean, a lot of those people, a lot of psych patients, they want their psych provider to prescribe them their primary care needs
Hmm.
too, right?
Yep. And that's what I've been doing here at the VA. And I'm like, why don't I get paid for this? Because I'm
Right.
actually sitting here counseling. Um, and a lot of my patients are saying, hey, I'd rather come see you than my psych provider, or I can't reach them. So that's why I even went back to school to make sure that I was safe and I knew exactly what I was doing. And I have something. And I just need to know how to build on it.
Right, right. Okay, so you have the
Yeah.
experience. I mean, it sounds like you could probably just hit the ground running immediately then, right?
Yeah. Yeah.
Yeah, yeah. Okay. So, God, I'm telling you, I think I would really focus in on doing like a psych primary care thing.
Okay.
And yeah, I really would. So this is my advice for you is I would just probably accept the fact you're going to need to take insurance. Okay. Now, yeah, it's a pain in the ass. Yes, it is. But if you can get a good medical biller and a good credentialer, it's really not that bad because you're going to have someone else doing the majority of the billing and stuff for you.
Yeah. Okay.
Okay. So if you find a good one who's paid commission based off of what you're generating, they should do a pretty good job for you. Okay.
Okay.
I mean, you already work in the VA anyway, so you already know red tape and everything. Like
Yep.
you're already used to it. So, so my advice for you is to find a local credentialer biller immediately and begin credentialing now
Okay.
because it typically takes 6 months to get fully credentialed with insurance.
Okay.
Okay. And so I would get credentialed as primary care. All right.
Okay.
And then once you get your psych certification, then you would apply for that. Now you're already fully credentialed, so adding the psych should not be difficult.
Okay.
Okay. Um, and if you have the psych certification, you should be able to start billing those psych codes anyways. You might not need to get fully credentialed for it. I'm not entirely sure. So you would need to talk to the medical biller about that. But
Okay, I'll double check.
yeah, but it could just be as simple as adding a taxonomy code to your credentials, and that's that. It could be a really straightforward process.
Okay.
Okay. So I would begin getting credentialed immediately. Okay. So your LLC that you have, you need to get a group NPI number. And then that group NPI, your business will get credentialed. All right. I hope everyone's enjoying the episode so far. I just wanted to take a quick break to thank everyone listening and also give a big thank you to all of my social media followers and email subscribers. If you haven't done so yet, please subscribe to our email list at www.elitenp.com and make sure to follow us on Facebook, Instagram, and LinkedIn. Email subscribers will receive updates on new weekly podcast episodes, multiple weekly articles we publish, new courses, and everything else related to helping you succeed. Remember, all elite nurse practitioner courses are designed to help you build a niche practice, increase your financial strength, and to break free from the rat race. If I can break free and the other countless nurse practitioners can break free, then so can you. Additionally, please share this podcast with your other nurse practitioner sisters and brothers out there. The more NPs that venture out on their own, the stronger our profession will become. Now, let's get back to the episode. So do that now. Get it done. Because it's going to take a little while. Yeah.
Thank you so much. All right.
Now in the meantime, though, I mean, it's going to take 6 months. So what's your plan? You're just going to continue working and saving some money up? Like, what are you?
Oh, yeah. I'm not going to stop. So I have everything in place. I had already worked the credentialing company. I just don't know what happened with the Medicare and Medicaid. I've been credentialed with Aetna and Cigna, and that's it. But I paid for all these other things, and it didn't happen. And when I call, they don't respond, and it's nothing. So I don't know if I need to go to see someone else to call someone else to get it done. But that's all I'm missing.
Wow. Okay. Yeah, I would I would call someone. They should be able to pick up everything. Like they should be able to clean the mess up and get it going.
Okay.
Are you going to go ahead and get this office space that you like?
Yeah, I'm just praying that everything goes well with my my loan process. So that's all I'm waiting on right now for the underwriter.
Right. You're taking out a business loan?
Yes.
How much are you taking out?
140.
140,000?
Mm-hmm.
For what kind of practice are you wanting to start? You don't need
It's a building.
So you're going to buy the building?
Yes.
Oh, okay. Well, then that's different. I thought you were going to take a $140,000 business loan out to start the practice. Oh, like what the hell? What are you? The hell kind of practice are you starting? You have a saltwater aquarium and a bunch of, crazy stuff in there. Like, geez. Okay. Okay. So you're going to buy the building. Okay. That makes sense. All right. Is the building like multiple offices, multiple spaces, or is it just kind of like one single?
It was actually a daycare, and I'm going to do a build out in there and just I need 3 rooms, exam rooms. One is going to be for the mental health, and then the other 2 for primary care.
Okay, perfect. Okay. How much square footage is the place?
It's right at 1,900 square feet.
Perfect. Okay. I mean, that's you probably won't even use all that space, but that's more than enough.
Yeah.
Yeah. Okay. Is it going to take a lot of build out, or is it mostly just kind of moving some walls and just fixing some things?
Yeah. Just adding walls, because the areas that she had, I'll need to add sinks because these were for the children. So I just need to change some little things. Not much.
Very nice. And there's a reception area, a room, all that stuff.
Yep. And it has a little area for like a kitchen. So,
wow. Okay.
Once I add staff going, we're good to go.
Yeah. Okay. And then the big daycare site out there on the main road, you can go out there and pop a new sign that says whatever.
Changing all of that. Yep.
All of it. Okay. So, geez, why the hell are you talking to me for? You got all this
I just needed confirmation because, sometimes you get slow because a lot of things happen and you get a no and you think that that's just it. and you'll want to give up and
Right.
you'll stall. And that's what I have been doing. And I said, let me just reach out and just get confirmation. And I just appreciate you just responding. I really do.
No,
And I
you're
had,
welcome.
I'm in the inner circle and I'm like, I'm spending money to get this knowledge and I'm not utilizing it. What are you doing? So I just need a kick in the behind. That's it.
Yeah, yeah, yeah. The analysis paralysis is a real thing, isn't it?
Yes, it
Yeah,
really is. It really
yeah.
is.
Well,
Yeah.
once you sign that building, you're pretty much committed,
Yes, I'm in
Um,
it.
you're in it. Yeah, yeah. And God, thank God I talked to you. Like cash based, and you're kicking out $140,000 loan. That was big risk. Yeah, you really
Yeah,
should take insurance. Now, are you planning on hiring another nurse practitioner to see patients there as well?
most definitely. And we're going to do some outreach. So I'll be doing the Medicare, Medicaid evaluations so that'll bring in some more income.
Okay. Now, where are you going to find time to do this and also work at the VA?
So that's why I'm trying not to kill myself. Most of this is going to be on the weekend
Ooh, okay.
um, and evenings. So
Okay.
now that my kids are older, I can do it.
What's your schedule like at the VA?
8 to 4:30.
Monday through Friday?
So, and then
Ooh.
I'll be working my practice from 5:30 to 9:30.
Ooh.
Yeah.
Yeah. Okay.
Yeah. I have to do it for a little while until I can get that money going. And then
Yeah. Yeah.
I'll fall back.
Yeah. Yeah. I mean, that's part of the sacrifice of starting a business. If it was easy, everyone
Yeah.
would do it.
Yeah.
I mean, it's easy to do. It's not that hard. It's work,
It's a lot. It's a
It's a
lot.
lot of work. It's a lot of sacrifice. Yeah.
Mhm.
Um, well, if I was you, if I was you, I'd be trying to find another nurse practitioner as quick as you can
Okay.
to get in there and start seeing some patients for you, or, as fast and as quick as you possibly can, because you're going to have a lot of limitation based off of your schedule, right?
Right.
And
Right.
so if you could get another nurse practitioner in there, even part-time, maybe they could just work, I don't know, let's just say like a Wednesday and a Thursday or something or whatever. Even just having someone else in there just 2 days a week seeing patients for you will really help build the census up, and it'll also help generate some income. Okay.
Okay.
Yeah. Pay them just on production. If
Okay.
you pay them on production only, it's minimal risk to you.
Gotcha.
Okay. Because if they're not seeing patients, they're not getting paid. Right.
Right.
So if you give them 50% of collections, then it motivates them to work their ass off and see a lot of patients, and then you collect the other 50%. Now, out of that 50%, half of it's going to go to expenses. You know what I mean?
hmm
But the other 25% is a profit,
Right.
or you're not doing
Mm,
anything.
exactly.
Right.
Okay.
Yeah. So if you do that, I think that you'd be able to build this up fairly quickly. And I think you'll start seeing the magic of passive income and having someone else work for you. And you can keep doing your VA thing. And, like, keep that $2.3 million figure in your mind for your pension. Okay.
hmm
Because that's what $90,000 a year is worth. It's worth about $2 million. Keep that in the back of your mind, because what might happen is that this business starts really taking off and you start making a lot of money, and you're going to tell yourself, is working at the VA still worth my time, or could
hmm
I really go in on this business
Right.
and make more money? You could potentially make more money. That pension might not even be worth your time anymore.
Right.
Yeah.
That is the goal. Seriously.
Yeah. Yeah. I've seen that happen to a few people before. Like they
That
just
is the
said,
goal.
yeah, they said, screw it, and just moved on. So,
Yeah.
um, yeah. Okay. Any other questions? Anything else you want to talk about?
No, you're amazing. I really appreciate you.
You're welcome. It was kind of a shorter episode, but it was kind of straight to the point. So, yeah, awesome. Well, listen, I like to end the episode with you asking me a question, personal question or curiosity or anything. Do you have anything like that, a curiosity of anything you ever wanted to ask me?
Um, I just want to know the mindset of a millionaire. Like, how do you really get all that doubt, jump in, take the risk, and do what you need to do to get everything done to accomplish your goals, especially financially?
Yeah. Okay. So I think that um, to be a millionaire, you have to be willing to take a risk first and foremost. Okay. I don't think I necessarily had a millionaire mindset before I became a millionaire. I think I was just willing to take a risk. Like I was willing to
Okay.
put the work in and to take the risk and to not quit. So I think that's probably one of the biggest things that you need to have. Once you start generating enough money and you build a business that's worth $1 million and you technically become a millionaire, you know, um, I think the mindset changes a little bit that you're okay with risk now. You see that
Mhm.
it's generally it pays off and it's really all the worry, all the fear, all the doubt that you had originally was really probably unfounded, and you realize that, and you're willing to take a risk a lot more. And by that I mean you're willing to take the risk of starting another business. Like you could just go ahead and just start another business, and and you're not even lose sleep over it. You
Right.
know, and and you also understand how you can leverage uh, the work of others to increase your wealth even more. And that's
Perfect.
what I mean by you hiring another nurse practitioner as fast as possible. And you'll realize this is where the real money is by leveraging others uh, to work and build and, to kind of build your business.
Right.
Yeah.
And
So,
I'll just share something with you. When I left Tennessee, I left running. I was in a situation of domestic violence with my ex-husband. And when I moved here, we were divorced, and he decided he wanted to take me to court for my children. And it was a terrible situation because he's already a millionaire, so he had money. I didn't. So everything that I had to really hold on to it. And he had my kids for a whole year, and that was devastating. And then
sure.
when I got them back, there was a lot of reconditioning I had to do. It was a lot. I lost everything. I lost my car because I had used all my money to move. And I was literally walking to work, and one of my nurses saw me walking. And she was like, "What are you doing?" I'm like, "Oh, my car just broke down." And this young lady was like, "I'll take you to work." And she would bring me to work, pick me up, take me back home. Until finally I admitted what was going on. And it was a humbling experience. I'm thankful I made it through, but it also made me really reserved. And I'm trying to get through that. And maybe this can help somebody else. But I'm at the point now where I know my word, and I know that I'm a diamond in the rough here. And I've been abused at this job. And I just
Sure.
stayed here, and I stayed here, and I've taken it, and I've taken it, and I'm really done. But I know I can't move because I have a certain lifestyle, but I don't want to be trapped. So now I'm at that point where I'm like, you know what? Fuck it. I'm going to do it. So that's why I reached out to you. I took the chance. I joined the circle. I don't mind investing in myself, and that's how I see it. So I know this is going to pay off. I just needed that confirmation today. So I really appreciate you. I know this is
No,
short, but thank you.
you're welcome. Seriously, listen, if you can get through that situation, a business is a cakewalk. Okay.
Yeah.
Like
Yeah.
you can get through that, you can do this. And I understand having that reservation. Like I get it. I mean, I grew up dirt poor and I went through some really rough times. And I think honestly, situations like that, it just makes you a stronger person. And as an entrepreneur, I think it's going to allow you to be a lot more. It's going to allow you to develop that bulletproof skin
Yeah.
because you know that you've been in worse situations before. And so when the entrepreneur, the business startup, whatever it is that you're doing throws you a curveball, you're going to say, you know what, this really isn't that bad because I've been in a lot worse. Right.
Yeah.
Yeah. So I think you're going to be just fine. I mean,
Thank you.
you already have this entire plan. Like, I'm just like, you have everything set up here. Like, just get it going. I think once you start and you see that first patient and you start seeing that money land in your account, you're gonna be like, geez, why didn't I do this a decade ago?
Yeah. Yeah.
Yeah. Yeah. So cool.
Well, thank
All
you.
right, you're welcome. Well, listen, you got my email. So if you ever want to do a follow-up, let me know. And yeah, I appreciate your time and best of luck and keep me updated.
Okay. Thank you. Have a good
Cool.
one.
All right, you too. Take
Bye.
care. All right, bye. I hope everyone enjoyed the episode with Kimberly. I know it's a little bit of a shorter episode, but I mean, she already had everything set up, it sounded like. Like she just needed a little bit of confirmation, right? She just needed that positive kick in her butt, basically. So, keep that in mind. Sometimes, guys, you don't really need a whole lot of help. Like, you have this. You could get through school, you could get through all these difficulties in life. Why can't you start a business? Why can't you take your business to the next level? You can do this. It's not that hard. I mean, you've done harder things in your life. I promise you have. Like starting a business is not that hard. Expanding your current clinic, it's not that hard. It's just focusing in on it and doing it. Like if you ever need a positive kick in your ass, just shoot me an email. I'm more than happy to. Or you can hop on to our podcast. I'm more than happy to talk to you, okay? But like you guys got this. You got it. You got through school. You got through life. You've dealt with kids, et cetera, et cetera, et cetera. If you can do that, you can do this. All right, hope everyone enjoyed this episode. Talk to you guys later. Thanks, bye. Thank you for listening to the show. Quick legal disclaimer. The content of this podcast is meant for informational and entertainment purposes only and should not be used as legal, financial, medical, regulatory, or practice-specific advice. For information pertaining to your specific legal, financial, medical, or practice-specific needs, please be sure to consult with your lawyer, CPA, medical director, and or your state's practice laws and the most up-to-date clinical guidelines. As always, do your due diligence when it comes to any information found online and in podcasts. The content in this podcast is copyrighted by Galaxy Medical Southwest 2023 and cannot be duplicated, rebroadcasted, or reproduced without our written permission.